fall, the Big Ten and Pac-12, two of college football's Power Five conferences, they will not be taking the field. One of the game changers for both conferences was the appearance of myocarditis, which is an inflammation of the heart muscle that can be caused by a number of different viruses, including COVID-19. Joining us now is Dr. Jossef Amirian, who is the board-certified cardiologist at Manhattan Cardiology. Great to have you here with us today, Doctor. For our viewers who may not know, what is myocarditis and how do viruses such as COVID-19 perhaps cause it?
Thank you for having me. So, myocarditis is inflammation of the heart muscle that leads to myocardial damage without a blocked artery causing it. And typically, myocarditis is usually caused by a viral illness that precedes the actual myocarditis that we see.
And so, walk us through cases in the past where you have seen myocarditis, and especially within athletes, and what was the either recovery process like after being diagnosed, and then what are the things that you have to look out for even after diagnosis?
Yes, exactly. So, myocarditis, in the overwhelming majority of patients, they may be asymptomatic and have myocarditis, this inflammation. And usually myocarditis self-resolves. However, sometimes the presenting complaints can be highly variable. And so sometimes patients may present with fatigue. Oftentimes they may present with chest pain or a chest pain-like syndrome. The actual heart muscle can become damaged, and sometimes they can have what we call heart failure, where the actual pumping of the heart can become reduced. Sometimes patients can present with electrical instability, and we call those arrhythmias. Sometimes they can feel like their heart's racing out of their chest. They can have palpitations. And many times, patients present with different symptoms. But all the symptoms should be taken seriously because these symptoms could potentially be lethal if they go undiagnosed.
Now, the Big 12, the ACC, the SEC, they're going to kick off this month despite COVID-19 outbreaks at their schools. Given the risk of myocarditis, do you believe that these programs will be able to ultimately navigate the season, or are they putting themselves at too much of a risk?
I mean, that's a great question. I mean, I think for each specific sport and for each specific division within each sport, you really have to make an isolated decision. So the executives and the medical professionals who run those sports need to sit down and see, is it safe for the players, for the staff, and for everyone involved, given how COVID-19 has been contracted and is so easily spread and is so contagious. So really, they're going to have to sit down and talk to their medical teams to see, is it safe for these players and for everyone involved. You can look at the National Basketball Association, for example. That's done a great job in having their season continue into the playoffs, for example, where they have what we call a bubble in Orlando, Florida, and they're very strict with who comes in and out, and they're very proactive in testing. They do rigorous testing there, and if anybody breaks the rules or leaves the campus or leaves the site that's being monitored, they need to self-isolate for 14 days. Right. So, there's two approaches to take there.
Now, the Boston Red Sox pitcher, Eduardo Rodriguez, also sitting out this season after being diagnosed with myocarditis. How long do you believe it will take for athletes with the heart condition to return to 100% effectiveness?
So really, it's not known if once you have myocarditis, how long it will take you to recover from the myocarditis. The inflammation and the symptoms that come about from myocarditis can sometimes take months until somebody recovers. Again, the majority of patients do recover, and it usually self-resolves. However, these patients need to be monitored, and sometimes it takes months for them to get back to their baseline, but some of them may not get back to their baseline. So they need to be monitored and treated thoroughly by a physician throughout their course.
Dr. Jossef Amirian, who is the board-certified cardiologist at Manhattan Cardiology, joining us here today. Thank you so much, doctor. We appreciate the time and insight.